Client is ordered to receive gold therapy. The client asks how long it will take for him to feel the effects of this medication. The nurse teaches the client that gold medications, A. achieve the desired effect in 1 to 2 months. B. achieve the desired effect in 3 to 4 months. C. alleviate symptoms immediately. D. are effective within 7 days of therapy. Answer. B. achieve the desired effect in 3 to 4 months. Rationale. Gold therapy, or chrysotherapy, takes 3 to 4 months to reach effective levels. Clients with which disorders are most often responsive to the NSAID groups of medications? A. Rheumatoid arthritis and osteoarthritis. B. Postoperative pain and discomfort. C. Infections and incisional pain. D. Gastrointestinal discomfort and bleeding. Answer. A. Rheumatoid arthritis and osteoarthritis. Rationale. NSAIDs assist with pain and inflammation. Postoperative and incisional pain should be treated with narcotics. The NSAIDs should not be used with the client who is exhibiting gastrointestinal discomfort and bleeding. Answer. C. Instruct women to take NSAIDs during heavy menstrual flow for pain. Rationale. NSAIDs may increase the client's bleeding time, which may increase bleeding time during menstrual periods. A client is ordered to receive aspirin after an acute heart attack. The nurse is evaluating use of this medication with other medications. The nurse is aware that aspirin can cause which drug interaction? A. Increased risk of bleeding with anticoagulants. B. Decreased risk of hypoglycemia with oral hypoglycemic drugs. C. Decreased ulcerogenic effect with glucocorticoids. D. Increased risk of infection with amoxicillin. Answer. A. Increased risk of bleeding with anticoagulants. Rationale. ASA is an anticoagulant that may increase the bleeding time when used with other anticoagulants. A client is ordered to receive an NSAID for a disorder. The client states that she is aware that NSAIDs are frequently taken to decrease inflammation. The nurse clarifies that these agents may also be taken to A. Decrease pulse rate. B. Reduce body temperature. C. Decrease blood pressure. D. Increase platelet aggregation. Answer. B. Reduce body temperature. Rationale. One of the functions of NSAIDs is to reduce body temperature. Indomethacin, Indocin, is highly protein-bound and is ordered as a new medication for the client. The client is taking another medication that is moderately protein-bound. Upon administration of both medications, the nurse should be most concerned with A. Indomethacin toxicity. B. Indomethacin levels below the therapeutic level. C. An increase in medication side effects. D. Toxic levels of the first drug. Answer. D. Toxic levels of the first drug. Rationale. The indomethacin would replace the first drug, allowing more of the first medication free for active drug levels. A client with rheumatoid arthritis is ordered to receive tumor necrosis factor, TNF, as treatment for symptoms. Which manifestations are of most concern to the nurse? A. Elevated temperature and a sore throat. B. Decreased range of motion and crepitation. C. Constipation and abdominal pain. D. Poor skin turgor and increased urine-specific gravity. Answer. A. Elevated temperature and a sore throat. Rationale. TNF may cause immunosuppression and increased risk for infection. In teaching a client about NSAIDs, the nurse is careful to teach about how to monitor for side effects. What side effect is of special concern? A. Tachycardia. B. Polyuria. C. Elevated temperature. D. Gastrointestinal upset or distress. Answer. D. Gastrointestinal upset or distress. Rationale. NSAIDs commonly cause gastrointestinal lining breakdown that may lead to ulceration. Client teaching related to colchicine, novocolchine, includes which instruction? A. Take the drug on an empty stomach. B. Keep fluid intake to no more than 1,000 milliliters daily. C. Take a laxative daily to prevent constipation. D. Take the drug with food. Answer. D. Take the drug with food. Rationale. The drug should be taken with food to avoid gastric upset. A client is receiving Aranafin, Ridora. Which instruction takes priority? A. You may have a salty taste in your mouth. B. You may experience constipation. C. You may experience visual changes. D. You'll need frequent blood counts drawn. Answer. D. You'll need frequent blood counts drawn. Rationale. Agranulocytosis and thrombocytopenia are potentially life-threatening adverse reactions to the medication. The client has been ordered to be treated with allopurinol. He complains to the nurse that he has noted changes in his vision. What is the most appropriate nursing intervention? A. Explain to the client that this is an expected response to the drug. B. Call the physician. This is a life-threatening response to the drug. C. Explain to the client that this is a normal side effect of the drug. D. Call the physician. This is an adverse reaction to the drug. Answer. D. Call the physician. This is an adverse reaction to the drug. Rationale. An adverse reaction to allopurinol is the development of cataracts and retinopathy. The client is an older adult who has been diagnosed with cardiac arrhythmias. She has been ordered to be treated with Remicade. What should the nurse do? A. Administer the medication as ordered by the physician. B. Administer the drug after clarifying the dose with the pharmacist. C. Hold the drug and conduct the physician. The dosage should be decreased. D. Hold the drug and contact the physician. The drug is contraindicated. Answer. D. Hold the drug and contact the physician. The drug is contraindicated. Rationale. Remicade is contraindicated when the client is elderly and is experiencing cardiac arrhythmias. The client has been ordered to be treated with Ridora. The nurse anticipates seeing an increased what in the client's laboratory results? A. Fasting blood glucose. B. Liver enzyme test. C. Potassium level. D. Calcium level. Answer. B. Liver enzyme tests rationale. The client who is being treated with Ridora may exhibit a slight increase in liver enzyme tests. The client has been ordered to be treated with Benamid. What is the highest priority instruction to give the client? A. Take on an empty stomach. B. Increase fluid intake. C. Take with food. D. Limit fluid intake. Answer. B. Increase fluid intake. Rationale. The client who is being treated with Benamid should increase his fluid intake because this will promote the urinary excretion of uric acid. A client is ordered to receive an NSAID for osteoarthritis. Which nursing intervention will treat the side effect most commonly associated with the NSAIDs? A. Taking the medication with meals. B. Using sunscreen. C. Avoiding crowds. D. Encouraging deep breathing. Answer. A. Taking the medication with meals. Rationale. The most common side effect is gastric upset, so taking the medication with meals will assist with these symptoms. A client is ordered to receive a medication to relieve inflammation. The nurse determines that the medication is needed quickly. The nurse anticipates that which drug form will be ordered so that the medication can be released rapidly. A. Tablet. B. Enteric-coated pill. C. Capsule. D. Liquid suspension. Answer. D. Liquid suspension. Rationale. This medication does not need to go through the dissolution phase, so it is more rapidly absorbed. A client is ordered to receive celecoxib, Celebrex, for chronic pain caused by osteoarthritis. The nurse anticipates that the client will exhibit A. An increase in pain level. B. An increase in bleeding time. C. Erosion of the stomach lining. D. A decrease in inflammation. Answer. D. A decrease in inflammation. Rationale. A decrease in inflammation is the anticipated function of this medication. A client diagnosed with acute gout is prescribed allopurinol, Xylopram. The nurse is reviewing the client's medication history and will contact the healthcare provider if the client is taking A. Diphenhydramine, Benadryl. B. Metoclopramide, Reglan. C. Propranolol, Inderol. D. Warfarin, Coumadin. Answer. D. Warfarin, Coumadin. Rationale. Allopurinol, Xylopram, increases the effects of warfarin, Coumadin. Allopurinol does not interact with diphenhydramine, metoclopramide, and propranolol. A 75-year-old woman has been given a nonsteroidal anti-inflammatory drug, an NSAID, for the treatment of rheumatoid arthritis. The nurse is reviewing the patient's medication history and notes that which types of medications could have an interaction with the NSAID. Select all that apply. A. Antibiotics. B. Decongestants. C. Anticoagulants. D. Beta blockers. E. Diuretics. F. Corticosteroids. Answer. C. Anticoagulants. E. Diuretics F. Corticosteroids rationale. Anticoagulants taken with NSAIDs may cause increased bleeding tendencies because of platelet inhibition and hypoprothrombonemia. NSAIDs taken with diuretics may cause reduced hypotensive and diuretic effects. NSAIDs taken with corticosteroids may cause increased ulcerogenic effects. A patient has used enteric aspirin for several years as treatment for osteoarthritis. However, the symptoms are now worse, and she is given a prescription for a nonsteroidal anti-inflammatory drug and misoprostol, Cytotec. The patient asks the nurse, "Why am I now taking 2 pills for arthritis?" What is the nurse's best response? A. Cytotec will also reduce the symptoms of your arthritis. B. Cytotec helps the action of the NSAID so that it will work better. C. Cytotec reduces the mucus secretions in the stomach, which reduces gastric irritation. D. Cytotec may help to prevent gastric ulcers that may occur in patients taking NSAIDs. Answer. D. Cytotec may help to prevent gastric ulcers that may occur in patients taking NSAIDs. Rationale. Cytotec inhibits gastric acid secretions and stimulates mucus secretions. It has proved successful in preventing the gastric ulcers that may occur in patients taking NSAIDs. A mother brings her toddler into the emergency department and tells the nurse that she thinks the toddler has eaten an entire bottle of chewable aspirin tablets. The nurse will assess for which most common signs of salicylate intoxication in children. A. Photosensitivity and nervousness. B. Tinnitus and hearing loss. C. Acute gastrointestinal bleeding. D. Hyperventilation and drowsiness. Answer. D. Hyperventilation and drowsiness. Rationale. The most common manifestations of chronic salicylate intoxication in adults are tinnitus and hearing loss. Those in children are hyperventilation and CNS effects, such as dizziness, drowsiness, and behavioral changes. A patient with gout has been treated with allopurinol, Xylopram, for 2 months. The nurse will monitor laboratory results for which therapeutic effect. A. Decreased uric acid levels. B. Decreased prothrombin time. C. Decreased white blood cell count. D. Increased hemoglobin and hematocrit levels. Answer. A. Decreased uric acid levels. Rationale. Treatment of gout with allopurinol should result in decreased uric acid levels. The other options are incorrect. A patient is taking the nonsteroidal anti-inflammatory drug Indomethacin, Indocin, as treatment for pericarditis. The nurse will teach the patient to watch for which adverse effect. A. Tachycardia. B. Nervousness. C. Nausea and vomiting. D. Dizziness. Answer. C. Nausea and vomiting. Rationale. Gastrointestinal effects include dyspepsia, heartburn, epigastric distress, nausea, vomiting, anorexia, abdominal pain, and others. The other options are not adverse effects of NSAIDs. The nurse is reviewing the therapeutic effects of nonsteroidal anti-inflammatory drugs, NSAIDs, which include which effect? A. Anxiolytic. B. Sedative. C. Antipyretic. D. Antimicrobial. Answer. C. Antipyretic rationale. NSAIDs have antipyretic effects but not the other effects listed. The nurse is reviewing the history of a patient who has a new order for a nonsteroidal anti-inflammatory drug, NSAID, to treat tendinitis. Which conditions are contraindications to the use of NSAIDs? Select all that apply. A. Vitamin K deficiency. B. Arthralgia. C. Peptic ulcer disease. D. Neuropathy. E. Pericarditis. Answer. A. Vitamin K deficiency. C. Peptic ulcer disease rationale. Contraindications to NSAIDs include known drug allergy as well as conditions that place the patient at risk for bleeding, such as vitamin K deficiency and peptic ulcer disease. NSAIDs may be used to treat arthralgia and pericarditis. Neuropathy is not a contraindication. A patient calls the clinic to ask about taking a glucosamine chondroitin supplement for arthritis. The nurse reviews the medication history and notes that there will be a concern for drug interactions if the patient is also taking medications for which disorder? A. Type 2 diabetes mellitus. B. Hypothyroidism. C. Hypertension. D. Angina. Answer. A. Type 2 diabetes mellitus rationale. The glucosamine in glucosamine chondroitin supplements may cause an increase in insulin resistance, necessitating the need for higher doses of oral hypoglycemics or insulin. The nurse notes in a patient's medication history that the patient is taking allopurinol, Xylopram. Based on this finding, the nurse interprets that the patient has which disorder? A. Rheumatoid arthritis. B. Gout. C. Osteoarthritis. D. Systemic lupus erythematosus. Answer. B. Gout rationale. Allopurinol is indicated for the treatment of gout but is not indicated for the other disorders listed. During assessment of a patient with osteoarthritis pain, the nurse knows that which condition is a contraindication to the use of nonsteroidal anti-inflammatory drugs, NSAIDs. A. Renal disease. B. Diabetes mellitus. C. Headaches. D. Rheumatoid arthritis. Answer. A. Renal disease rationale. Contraindications to NSAIDs include known drug allergy and conditions that place a patient at risk for bleeding, such as vitamin K deficiency and peptic ulcer disease. Patients with documented aspirin allergy must not receive NSAIDs. Other common contraindications are those that apply to most drugs, including severe renal or hepatic disease. The other options are not contraindications. A patient who has a history of coronary artery disease has been instructed to take 181 mg aspirin tablet a day. The patient asks about the purpose of this aspirin. Which response by the nurse is correct? A. Aspirin is given to reduce anxiety. B. It helps to reduce inflammation. C. Aspirin is given to relieve pain. D. It will help to prevent clot formation. Answer. D. It will help to prevent clot formation. Rationale. Aspirin can reduce platelet aggregation, Low doses of aspirin, 81 to 325 milligrams once daily, are used for thromboprevention. Higher doses are required for pain relief, reduction of inflammation, and reduction of fever. The other options are incorrect. When a patient is receiving long-term NSAID therapy, which drug may be given to prevent the serious gastrointestinal adverse effects of NSAIDs? A. Misoprostol, Cytotec, B. Metoprolol, Lipressor, C. Metoclopramide, Reglan, D. Magnesium sulfate. Answer: A. Misoprostol, Cytotec. Rationale: the drugs of NSAIDs, non-steroidal anti-inflammatory drugs, category MASI, cause serious gastrointestinal tract (GIT) adverse effects. The drug to prevent these effects is misoprostol, Cytotec. The observations option-wise as follows. The drug for preventing the serious adverse effects on GIT of NSAIDs is misoprostol and not metoprolol. Rather, it is the drug for high blood pressure. The drug metoclopramide is used for the treatment of nausea and vomiting. The magnesium sulfate is the drug for constipation and not for the GIT adverse effects. The nurse is reviewing a patient's medication list during a preoperative visit. The patient is scheduled for diagnostic laparoscopy in 2 weeks. He asks the nurse, "I hope I can continue the Motrin. Because I really ache if I don't take it. It's just minor surgery, right?" What is the nurse's best response? A. You can continue to take it as the laparoscopy is considered minor surgery. B. You will need to take a lower dosage during the preoperative period. C. I'll check with your prescriber. But this drug is usually stopped a week before the surgery because it can cause increased bleeding tendencies. D. You can switch to aspirin before the surgery. Both aspirin and Motrin are over-the-counter pain relievers. Answer: C. I'll check with your prescriber. But this drug is usually stopped a week before the surgery because it can cause increased bleeding tendencies. A 49-year-old patient has been admitted with possible chronic salicylate intoxication after self-treatment for arthritis pain. The nurse will assess for which symptoms of salicylate intoxication. Select all that apply. A. Tinnitus. B. Headache. C. Constipation. D. Nausea. E. Bradycardia. Answer: A. Tinnitus. B. Headache. D. Nausea. During a teaching session about Antigout drugs, the nurse tells the patient that Antigout drugs work by which mechanism? A. Increasing blood oxygen levels. B. Decreasing leukocytes and platelets. C. Increasing protein and rheumatoid factors. D. Decreasing serum uric acid levels. Answer: D. Decreasing serum uric acid levels. Rationale: the anti-gout drugs act only by decreasing the uric acid concentration in the serum, either by increasing its excretion or decreasing its production. Gout is the joint problems that cause pain in the joints, especially ankles, due to accumulation of excessive uric acid. This problem occurs when the body produces uric acid in more than required amount or the kidney is not able to excrete it in maximum amount. The uric acid is a waste which proves harmful when not excreted in required amounts or produced in excess amounts. The anti-gout drugs act by either by decreasing the overproduction of uric acid or by increasing its excretion. The observations option-wise are as follows. The anti-gout drugs have no link with the blood oxygen levels. The anti-gout drugs do not affect the concentration of leukocytes and platelets. The increased concentration of proteins and rheumatoid factors is not a function of anti-gout drugs. A 6-year-old child who has chickenpox also has a fever of 102.9 degrees Fahrenheit, 39.4 degrees Celsius. The child's mother asks the nurse if she should use aspirin to reduce the fever. What is the best response by the nurse? A. It's best to wait to see if the fever gets worse. B. You can use the aspirin, but watch for worsening symptoms. C. Acetaminophen, Tylenol, should be used to reduce his fever, not aspirin. D. You can use aspirin, but be sure to follow the instructions on the bottle. Answer. Circa, acetaminophen, Tylenol, should be used to reduce his fever, not aspirin. Rationale. Aspirin is contraindicated in children with flu-like symptoms because the use of this drug has been strongly associated with Reye's syndrome. This is an acute and potentially life-threatening condition involving progressive neurologic deficits that can lead to coma and may also involve liver damage. Acetaminophen is appropriate for this patient. The other responses are incorrect. The nurse is teaching a patient who is taking colchicine for the treatment of gout. Which instruction will the nurse include during the teaching session? A. Fluids should be restricted while on colchicine therapy. B. Take colchicine with meals. C. The drug will be discontinued when symptoms are reduced. D. Call your doctor if you have increased pain or blood in the urine. Answer. D. Call your doctor if you have increased pain or blood in the urine. Rationale. Colchicine may cause renal effects, therefore, these symptoms must be reported immediately. The drug is taken on an empty stomach for better absorption, and fluids should be increased unless contraindicated. Successful treatment depends upon continuing the medication as ordered.